Hello, everyone, and welcome back to the World's Okayest Physical Therapist podcast, hosted by me, Dr. H. And as always, please don't forget to like, comment, subscribe, share, leave a review, all the above, to help spread this podcast and to get it out and into the world, to help educate and inform people so that we can all figure out together how to better navigate the American healthcare system, to know who we should be talking to, when should we be talking to them, and how all these different professions can help benefit us. Today, we're taking a little bit of a detour. Today, we're taking a look at the history of physical therapy, not as a whole, but one specific gentleman in particular. In this episode, we are delving way, way, way back into the Roman times, um, the Roman Empire, and a gentleman named Galen. So we are heading back into the world of, well, the brutal world of gladiators. And we're going to take a look at how they were treated. So you might be wondering, what does this have to do with physical therapy? Well, in the Roman world, gladiators were elite athletes. They were a large investment of money, training, and time, and they were used, of course, to entertain the masses. But with any sort of sports enterprise, you have to treat your athletes well. You have to be able to help them recuperate. You have to help them stay in the Coliseum, whatever Coliseum they're in, staying in the arena, helping you make money or entertain the masses because that's their purpose. A gladiator who is not a good fighter and not an entertaining fighter is not going to win you the goodwill of the people. And if you are using circuses and games in order to distract people and to keep yourself popular and you don't have good gladiators, that becomes a problem pretty quick. So, like any sort of um, athlete or any sort of sport, you're going to naturally find people in that environment that are helping keep the athletes on their feet and in the game. Now, at the heart of this early rehab system is a gentleman whose name I already said, Galen of Pergamon. I think it's pronounced Pergamon. Pergamon, yeah. He was a physician, a philosopher, and a gladiator doctor. So today's title is going to be Rehabbing a Roman Gladiator, the Ancient Origins of Physical Therapy. So in a lot of senses, Galen is the first sports medicine doctor. Now, he was born in 129 AD in what was now Turkey. He was a Greek physician who was trained in the medical schools of Alexandria and Pergamon, and he made his way to Rome where he became the personal physician to Emperor Marcus Aurelius. Yes, that Marcus Aurelius, the one that ended up writing Meditations. Now, before that, he served as a doctor to gladiators, and that's the part that we're going to focus on because it's the part that has to do with physical therapy. Keeping in mind that Galen worked with this patient population, I guess we could say that of gladiators, he observed a lot of traumatic injuries every day. He would look at lacerations, which would be, of course, cuts. He would look at bone fractures, joint issues, it could be like dislocation, subluxation, all the above, and organ issues. He got to understand how muscles and movement worked centuries before we would have anybody going through and sketching in their parchments these muscles again. So Galen was here basically seeing how each muscle, and in a lot of cases I imagine as well, nerves fired in order to create movement in the human body. So he treated these wounds, he realigned joints, and he reduced fractures, and he set them in splints. And then his goal was to get them back on their feet. See, his idea here, his task, this is what's interesting about Galen to me. His task that was given to him wasn't just, okay, this was a human being who suffered a traumatic injury in the arena. Now we're going to medically retire him and let him become a citizen and live amongst the people. Oh no. They were like, we need to get this guy back on his feet in the arena so he can fight again as soon as possible. Galen, how are we going to make that happen? So in a very real sense, this is the earliest case that we know of doing a sports-specific rehabilitation. That he's doing this now 2,000 years before we really ever create that term, and we think about it now in terms of soccer, football, rugby, whatever. But here's Galen doing it for gladiators. Now, what did physical therapy look like to Galen? Well, the very first thing you have to think about is wound management. So, splinting broken bones and setting them, cleaning and binding cuts, using herbal salves, and any sort of concoctions he could get to reduce pain and inflammation. These are going to be huge things, right? So, effectively, what is he doing? Um, in a modern PT setting, he's looking at, is there a fracture? Yes or no. Do I believe there's a fracture? Yes or no. Okay, if there's a fracture, what's the appropriate thing to do to set it? If you don't have a fracture, what's the next steps from that? Are you presenting with a wound? Yes. Okay, well, is the wound to be cleaned? Yes. Okay, what type of wound is it? In a very real sense, in the PT world today, we have an entire class in our doctorate level studies that focuses on different types of wounds and how to identify them. Now, we're not the wound specialists, but we are trained to recognize them. Galen here would have had a lot more skill at dealing with traumatic injuries. Next, we have manual therapy, which people always call massage, but as we talked about in the previous episode, that's not the case. Now, manual therapy, Galen uses um, manual therapy for stretching, manipulation, and warming up the tissues or working out tension in the tissues. Now, in addition to this, the Romans also had lots of um, I want to say hot tubs, but they had the baths. And in these elaborate bathhouses, they would have hot water baths and cold water baths. And I imagine Galen would also have known, okay, if you're presenting with this sort of issue, let's say increased muscle tightness, I'm going to put you in the warm water bath, and then we're going to do manual therapy and stretching manipulation afterwards. So he would have been using this as a modality in order to help with these gladiators. And again, his interest here isn't just I want you to feel better. I don't want you to feel nice. I want to restore your range of motion. I want to restore your strength. I want to restore your function to get you back into the arena. So this is a very targeted um, treatment. He's not doing this just to reduce someone's perceived sense of tightness in their muscles. He's trying to get this athlete back and into the ring. And so this is, of course, the first documented case we know of manual therapy. Um, though there is arguments for earlier cases, which I might touch on in a future podcast. Graded exercise. Galen also believed that movement was medicine, and he advocated for progressive exercises tailored to whatever the patient's condition was, meaning he is interested in meeting the patient or the athlete where they're at and training them where they're at. He's not going to excessively load them to where they could harm themselves. He's not going to underload them to the point where it's not beneficial. He's trying to create tailored interventions specific to what this athlete needs to help them get back to the field or into the arena. Now, there's lots of different types of gladiators. I imagine Galen here, coming from this approach, was thinking, okay, this is a specific type of gladiator who uses this specific type of weapon, who whose body requires him to move this sort of way to accomplish this task. So how can I help this specific type of gladiator get back to doing that sort of thing, right? So a gladiator that is throwing spears is going to be different than a gladiator that's using maybe two short swords or a shield and a sword, right? So it allows him to grade the exercise in a athlete specific way, so helping a gladiator that is an archer get back to being able to pull their bow back, that sort of graded exercise is going to look very different than a gladiator who needs to get back to swinging a sword, for example. And he was able to do progressive exercises tailored to both. Um, Here's a direct quote from Galen. Exercise is laborious movement, voluntarily undertaken for the sake of health. End quote. If it sounds familiar whenever you walk into a PT clinic, movement is medicine, right? Um, Built to make you better is another one that you can look up. There's tons of mottos out there that are practically the same thing. It's voluntarily undertaken for the sake of health. It's hard work, voluntarily undertaken to improve your health. And along these lines, you also have, like I talked about, it's a return to combat protocol, which is how do I help this athlete get back into combat? And so he goes from the injury maintenance to building strength to okay, now we're focusing on performance. We're performance based. So that would include like strength training, agility drills, and conditioning. All of this, which we're going to talk about in a minute, is going to be involved by it's going to be involved with another healthcare, I guess you could say, professional. It's so wild using those terms, talking about the Roman gladiators, but here we are. So, the next segment I want to get into is called the Gladiator Rehabilitation Team. Now, this is crazy. You have Galen, who's the physician, right? So, in the modern setting, that would be your doctor, your medical doctor, or your doctor of osteopathic medicine. Um, then you have the trainer. Now, in Latin, this is called the Lanista, which is hilarious because it makes me think of Lannister, but it's not, it's Lanista, and they oversaw the physical conditioning and combat drills. Now, you also have the massage therapists and manual laborers who are going to do manual work on this guy. That would also probably include anybody at the bathhouses that's working on them. And of course, you'd have the herbalists providing some sort of herb concoction or something, which could also be done by Galen. And then, of course, the people that are feeding them, which would be like their nutritionists, probably making sure they're eating a diet that makes their physique look a certain way. But what's crazy about this is it's an ancient multidisciplinary rehabilitation team designed to help get these gladiators back and into the arena. You have a doctor, you have effectively either a physical therapist meets an athletic trainer meets a personal trainer in the Lannister all in one, and then you have the manual therapists who are going in there and using their hands to reduce that tension, right, and stretch them and move them. You have effectively everything you'd be thinking of in a modern physical therapy clinic. Because the Lannister could include the physical therapy assistant, for example. So all of these people are bringing their skills to help get this guy back and into the ring, in a structure that is not too unfamiliar to us today. Um, and that's kind of the part that blows my mind is if we look at how Galen set things up 2,000 years ago, we kind of model our clinics the same way. And it's just because it works. I think Galen was very much a pragmatist, and he recognized um, how to put together a team to get the best outcome. And it's a system that is so robust and works so well that even if you have a period of time in human history where we forget or we lose the knowledge that Galen and the Romans had, and we fall into, quote, the Dark Ages, where we lose a lot of that knowledge. Even by the time we come back in the Renaissance and the Enlightenment and post-Enlightenment, it's such a robust and simple, pragmatic system that just works. It naturally comes back. Um, but here, things I really want to hit on is Galen pioneered the idea that movement heals. It can help you facilitate your healing and get you back to doing what you need to do. And he also emphasized individualized progressive rehabilitation, which is a crazy notion that physical therapists nowadays deal with. A lot of times, physical therapists can be like, it's a one size fits all response here. If this is low back pain and with this sort of thing, here's the things that always work. Don't worry about making it super individualized. These are just what this patient needs. So we are still struggling with that in 2025. And progressive rehabilitation, everybody would agree, is good for everyone because you just need to adapt the rehabilitation for what your patient needs. He also believed in manual therapy, but it was a specific tool in order to improve range of motion and to stretch and to reduce muscle tension for performance instead of just to make someone feel good. Um, and he also viewed health as a balance of these things: strength, function, um, to get to help the athlete recover and get back to performance. And it's crazy because when you think about it, he didn't have imaging. He didn't have ultrasound or x-rays or MRIs. He just had principles. And these principles that he utilized and these ideas, the structure that he set up, hold up even to today. So some of the concepts here that I want to talk about that he helped, or that maybe we could consider him the discoverer of, as far as we know, is injury evaluation. He would have done clinical evaluation of the wound. He Because he would have seen so many injuries, he would have had pretty good anatomical knowledge of the different muscles and blood vessels and things that are all around wherever the injury site was. So he's going to already be thinking, okay, if this muscle is severed, what is this athlete not going to be able to do? Or if there's a significant injury to this muscle group, what is this guy going to struggle with? He's already thinking those things, and he probably would have been able to identify either by looking, right, and seeing what's severed, or maybe by palpation, going and feeling the joint to see if it's subluxed or dislocated, um, and so on. But he was able to do injury evaluation without X-ray, MRI, and all those things. Manual therapy, the hands-on technique is going to be critically important to him. He's going to have to know through palpation, through feeling where those tension points are in a patient's muscles. He's going to have to be able to feel if a joint is out of alignment or if it just feels a little bit off. He's going to have to know all those things. So deep tissue manual therapy, joint mobilization, and muscle stretching are all going to be quintessential things that he's going to be using and probably teaching people in order to assess um, his patient population and treat them. Exercise, specifically therapeutic exercise, he's looking at using it for a graded return to combat. So instead of pushing them right back to doing what they were doing right before they were injured, he's going to slowly reintroduce those activities. So like if you have a gladiator who focuses on sword skills, he's not going to take them and put them right back into full contact um, mode and put them right back into the arena 2 days after they've dislocated or subluxed their shoulder. He's going to start with, all right, can you swing a sword? No. Okay, we're going to practice you just swinging what you can until we work up that strength and that range of motion again. Okay, now we're going to go from that to striking a post. Okay, now from striking a post to maybe some light drills. And then from light drills, build yourself back up to where we think you can handle going back into the arena. And again, that's where the Lanista would have really helped with that, because they're going to be the ones that really focus on that and say, hey, here's how we can get him back to fighting shape. Pain management, right? Another huge thing that we've talked about before. Instead of being able to send to a pain management doctor, Galen has to use what tools he has. So he doesn't have ice packs, obviously. He doesn't have Tylenol. He doesn't have Advil. He doesn't have Aleve. But what he does have is natural remedies. He has like willow bark, warm compresses, and wine, which he can use in order to address pain. And he's gonna use them, right? Anything else that the Romans have at that time, it's like, hey, we think this helps with pain. I think he also believed in the idea of the humors. So, like, if there was too much blood, that could cause an issue, too much bile, that could cause an issue. So, he's probably also taking a look at maybe some bloodletting or things like that, because he believed in balancing those things in order to help deal with pain management as well. Um, Interdisciplinary care. Galen's looking at himself as being a member of a team, right? He's not going to have the same knowledge as the trainers or the um, maybe the herbalists, but he is going to have a specialized knowledge of the anatomy and what's going on with the patient. And he's going to utilize and trust his team in order to help get that athlete back into the ring with all of their different specialties. And then finally, that return to play protocol is so critical. Return to combat protocol. That's something that we still struggle with today, perfecting. Every few years, there's a new foundational study or a paper that comes out that says um, the way that we have a return to sport protocol for this athlete or that athlete is actually out of date and not the most as effective. And here's the new hotness. Here's the newest, most effective return to play protocol. Galen here would have been doing the same thing. Each gladiator would have been an experiment for him to figure out how quickly he could get them back and into the arena, doing it what it is that they were supposed to be doing. So all of those things are so modern and foundational that it's insane to me that this guy was doing this in like 129 AD. And it's no wonder why he ended up going and working for the emperor, because when you do this, when you invent all of this and it works, you're going to have rich and famous people saying, you need to come work with me, and I need the same sort of recreated team around me to help me manage my health. It just makes perfect sense. So, was Galen the first physical therapist? No. No, he definitely was not the first physical therapist, but he definitely was the first guy who was figuring out all of these principles. If anything, he was more of like the physician that also was recognizing some of these issues. Um, and I would definitely say he's the father of the physical therapy philosophy, and he's definitely the one that has figured out a lot of our core principles. But I think he leans a bit much into the medical doctor side of things for me to call him a PT. Um, I would probably argue the Lanista and the manual therapist that he had working under him together would have became what I consider more of a physical therapist. Um, but it's hard not to call him. It's really hard not to at least call him an early father of physical therapy. Even though he wasn't one in my opinion, it's hard not to consider him as a founding father of our philosophy and our doctrines. But again, I think he's too much in the medical side of things. He's too much like probably stitching people up and all those sorts of things and being like a doctor. So that's why I hesitate to say he's the earliest physical therapist. Um, and because of him, um, he, I mean, he revolutionized the medical field so much that he got to work for Emperor Marcus Aurelius. Um, and his principles to this day, I don't remember when his works were discovered, if it was in the Renaissance or before that, but his works, even to this day, um, continue to inspire us um, because they are just, again, the principles that work. They're the things that physical therapy does today in a very similar way that he did them 2,000 years ago. So it's kind of proof positive that if it worked then, how much more could it work now? We have such better technology and skills. So, in case you can't tell, I absolutely fanboy over Galen, and I absolutely get lost in the idea of 2,000 years ago getting stuck with the job of taking care of gladiators and trying to get them back into the arena, because I can definitely see how that task itself just leads the mind to go and to find the things that work, and the things that work are the same things that work today. So, thank you all for listening. This has been the World's Okayest Physical Therapist podcast. Thank you for everyone who's joined the Patreon already. Please consider joining the Patreon, and please don't forget to like, comment, and leave a review, as I said earlier. And I will catch you guys all next podcast. Now, everybody stay healthy, stay fit, and stay awesome.